Hey, welcome to this event by UN students in Bergen Global and CMI in the Bergen International Week. Today, Magnus Hatlebakk will talk about Corona among the poor. He will present more about the event right after. I'm the leader in UN Students Bergen. We're a student group working with planning events like this. We have undergroups that are going to plan some big events after Christmas. Next semester, we're going to have UN Theme Week, and we're looking for people to join us planning these events and be a part of the undergroups that we have arranged. So yeah, you can also take a look at our Facebook site and send us a message if you're interested in knowing more about us, and then we'll send you an email with more information. According to this event, we really want you to ask questions. You can ask questions here by raising your hand, or you can ask a question over Zoom. Use the question thingy under Zoom there. Yeah, so yeah, thank you for listening. And yeah, this is Magnus Hatlebakk, and he'll take over from here. So thank you.
Good morning, everyone. I will use PowerPoint, so that will come up after a while. And since there may be people on Zoom online, so I guess we take most of the questions afterwards. Yeah. And now it seems like this is up and going. So I work here at CMI. I'm a senior researcher here. I've been doing work mostly in South Asia, in Nepal and India for many decades in fact. I work mostly in villages in Nepal and India, mostly in Orissa and India, but also traveled and done research in Africa. So after this pandemic started, I have started reading up on the pandemic and how that affects poor people. And as you will see, we know much less than we could expect. There are thousands of papers on Corona, but maybe not so much information, in fact. So I will try to talk about what we know and also a little bit about what we don't know. So I focus on the extremely poor people. So that's those people who have less than, now is $1.9 per day. And it's useful to translate this into Norwegian kroner, because this is in fact what you can survive on in Norway or the US, and not in those poor countries. So this is actually real money here. So this is for a family of 5, that is equal to 90 kroner per day, or 2,700 kroner per month. So I focus on this because there's still many hundred millions of people who are below this very low poverty line. So if we start thinking about this, so we know that markets actually adjust to this. So you can rent a room without anything, basically, in a city in Nepal or India or Tanzania for maybe, let us say, 900 kroner per month, so 30 kroner per day, and maybe you spend 40 on food and the rest on other stuff that you need. So this is what it means to be extremely poor. So if you have 2 unskilled laborers that work every day in this household, then we know that they will normally be above the poverty line. Okay, so if one of them have lost a job due to Corona, then they will drop below the poverty line. Okay, and what types of jobs do these people have? So many of the women, they basically do petty trading, and so they sell vegetables, they sell some tea maybe, or other goods. Or they're just farm workers, as the men also are. But the men also work in factories. In some countries, also women work in factories. But it's to be at that level of income, you are normally unskilled. So you don't have any particular skill, because skills get paid. So if you now drop below the poverty line due to Corona, then we know that in the short run, you actually might be able to postpone some of your expenses. Maybe the landlord allows you to pay the rent later, so that becomes a loan that you pay next year maybe. And you normally drop non-food expenses first. So as we will see later in the presentation, it seems like people are able to maintain the food consumption. In the long run, which in this case may be next year, people start selling assets. Or they just have to migrate away from where they are now. So for some people, that means to go back to the family at home in the village. For others, it means to leave the village and move to the city. So this depends on where you live and the situation and even your own life. So this is basically the main things I will say today. So I have many slides, but if you remember this, you have the main messages. So where do the poor live? They actually just released, the World Bank released a report just last week with updated numbers. And they were compiled for 2017-18. So the most recent numbers we now have on poverty rates are from a few years back. And it's now according to those estimates, and of course these are just estimates, but they're good, it's the best estimates we have. So 689 million extremely poor people did fine in 2017, and half of them, they live in only 6 countries, okay? So India, 133 millions, Nigeria, 79 millions, Congo, 50 about, Ethiopia, Tanzania, Bangladesh. So those 6 countries have half of the poor people in the world. And this is important to remember. So whatever happens in a few countries, you can reduce the poverty rate by a lot. And this is what has happened during the last decade. So China has reduced poverty to close to 0. And this has really affected the global poverty numbers. So when you look at graphs of the decline in poverty in the world, so in 1990 it was about 2 billion. Now it's down to about 700 million. That is most of that has come in China. Okay, so keep that in mind. It's the same, for any types of policy, including policy against corona. If you look at poverty, you can only look at a few countries. Of course, that doesn't mean that other countries are important, but if you try to learn how you can reduce poverty in the world, maybe focus on those with many poor people. If you increase the poverty rate to, let us say, $3.2 per day or $5.5 per day, it's still most of the extreme poor, Africa and South Asia. But if you look at the numbers I have on the slides, some of you may not be able to see them, but there you could see that if you increase the poverty line, meaning that you include people who are just above the extreme poverty line, then you will get relatively more poor people in. So I think this is China, but also some other countries. So there are many people just above the extreme poverty line in China and some other East Asian countries. But still, even at $5.5 per day, 70% of the poor will live in South Asia and Africa. You see that in Latin America, it's quite stable, so 3-4% of the poor live there, independently of the poverty rate. So now I talked about the poverty, and you remember these countries: India, Nigeria, DRC, Ethiopia, Bangladesh, Tanzania. And in this figure, there's more information, and it basically shows the same countries. So the big thing on the left there is India. Indonesia is there with some people that I don't mention. They are just below the 6 on the top. But basically, most of the poor people live in Africa. And there's also variation in how many people are poor. The percentage vary a lot between countries. So in India, it's only 10%. In Nigeria, it's 39%. DRC, as much as 77%. Okay. If we now turn to corona mortality rates, and I use mortality rates when I look at the spread of corona. So because we know there's underreporting. We know there's underreporting of infections, but when it comes to death, I believe, and it seems like the numbers are quite okay. You actually get very sick of corona. So for some time we thought there was a lot of underreporting in Latin America, but then it hit there. And now the numbers are just at the top of the worst cases are now in Latin America. So basically I believe the relatively low numbers that we find in Africa are actually still true. That doesn't mean that it may not increase in Africa later, but still quite low. So what I put on the slides here are those countries that we looked at. I did not include Tanzania because it seems like the data are not good there when you look up news report and so on from Tanzania. So what you find there is that India is relatively high, now at 82 deaths per million. Okay. Nigeria 5 deaths per million, DRC 3, Ethiopia 12, Bangladesh 34. Among these, India is really increasing. So if you look at more recent data, India will be more deaths compared to these other countries. These we can compare to other countries. So as I mentioned, Brazil really at the top, 722 million per million. US 676, Sweden 585, and I just included Norway for comparison with 51. So it is the case that corona still hits harder in middle and high income countries. Okay, that's an important message. So we read about India, but India is a very big place. Okay, so still a mortality rate in India that is comparable to Norway. So among the poorer countries, Brazil is a middle-income country, but have very high, and all of Latin America basically very high mortality rates. But Africa and India, the countries that I mentioned, are still low, although India is on the increase. So what can we do about this? There are basically two things we can do. So one is to stop travels, and this is what they did in East Asia. So immediately when they heard about the infections in Wuhan in China, they closed down the borders, even within China. And in many of the countries now in East Asia, the mortality rates are extremely low. Okay, so in Vietnam, 0.4 deaths per million. You remember the other numbers, in Norway is like 50, huh? So even compared to Norway, very low. They just closed the border, and they have now estimate for GDP growth in Vietnam is 2% in this year. Okay, they closed the border, kept up the local economy. So they also closed down the local economy, but just for a short period. Now it's basically open. Same in China, they're back to normal now, huh? Because they closed the travel restriction even within China. The more costly alternatives to allow travel, close down the economy when it gets really bad. And we see that's what most countries do. So when infection rates increase, they actually have to close down the economy. So all countries have done this, and I expect them to continue to do that. But maybe some countries did this too early. So I mentioned India here as an example. That leads to lots of economic costs that I will talk about on the next slide, I believe. And if you do this too early, then people may be less motivated in the long run. Huh? So it's harder to keep up this the lockdown after a while. And I think that may have happened in India and maybe also in Latin America. In Africa, we are not seeing the increase in corona cases to the same extent. Maybe that is because of the restrictions. We don't really know that. But also there have been high costs, maybe because they started too early. So what is the consequences for the poor of the lockdown? So I think the unskilled labor, and I say I think because we don't know a lot about this. There are lots of papers out there, but we don't really have good information in my mind. So I believe unskilled labor in the service sector may lose the most. And that is just because we know that service basically means to meet people. So that's the way you lose the job. So people don't go to those restaurants anymore. They don't go to the tea stall, maybe. Yeah. It seems like farm labor is still going on. This is just based on news reports. So what I see when I check the media in Nepal and India, where I work the most, but also in East Africa. So it seems like farm labor is still going on, but there may be a shift from hired labor to family labor. So people actually work more at home, and so there may be some farm workers that have lost their job. Same with construction, that is mostly outdoors, so that may still be going on. I don't really know. And this is a really common job among unskilled labor. So if you're a poor man or woman, in fact, they quite often travel together as husband and wife and work on construction sites. So you may even travel to the city, live there for 3-4 months and work on construction, both of them. And not only both of them, they at least all the children they bring. But as I said, we have very little information on this. So there's some evidence from newspapers, as I said. So this on the PowerPoint, this is a picture of a recent harvest in Kathmandu Valley. And the threshing that takes place afterwards. And all this is outdoors work. So it is not necessarily that high risk of infections. So I think this is just good. Yeah. In fact, when I looked at Nepal in the news there, so when the infection started, lots of Nepalis, they're working abroad. So lots of them came back to Nepal from all over the world, but in particular from India. And now I see in the news that they actually go back to India to start working again. So they don't find work at home, so they just go back. Maybe an indication that the economy is improving in India, but of course a risk of getting the virus. So now as researchers, what should we do? So we have to think systematically about this. So I said we don't know much, but we can start thinking about how we should investigate the cost for the poor. So it's obvious that reduced interaction among people may lead to loss of income. And when we go on to food, so you spend your income on food and other goods. So reduced production and or reduced trade in food may lead to higher food prices. So what we should expect if we go out and look at the data is that the poor people reallocate money to necessary goods such as food. So we should expect to observe a decline in income, but not necessarily in food consumption. So people give priority to the most important stuff, which is obviously food. And these predictions we can test on data. So what economists call a negative shift in demand, so a decline in demand, a shift to the left in the demand supply curve, if you can imagine that one. That will lead to a decline in food. So there's less demand for food, so the prices decline, decline in food prices. But if there's instead of a decline in income and then decline in food prices, a decline in production of food, and some people believe it is due to the corona pandemic, then you should expect an increase in food prices. So you are able to separate the decline in income from the decline in production of food by looking at prices. This far, we have only seen increases in food prices in a few countries when I look at the price data. So there's variation between countries, but it appears to be that in most countries, there's no increase in food prices. So that means that people have been able to maintain food consumption, okay, and production both, despite this loss of income. This may not last if Corona lasts into next year, into the lean season of next year. So then we can expect the food prices to go down if there's an income effect. And that is the most likely effect. It seems that production is staying high. So this is just, for those of you who can see this graphs, I looked at the prices here on the upper one for maize in Malawi, which is the main staple food in Malawi. And you see there's a big increase in prices, but that is before the pandemic. Okay, that was last year in December or into February before the pandemic. So that was for a completely different reason. That was because of this locust, the grasshopper crisis in East Africa, which maybe repeat itself now. It was some news on NRK, yes, 2 days ago, I think, on that. Then the prices dropped to normal levels after February, when the pandemic started. Similar in Tanzania. If you go to West Africa, there seems to be an increase in Nigeria, so they have some particular problems there, but not in Ghana, for example. Going to South Asia, India seems to be a good rice crop this year, and wheat prices have gone down. Bangladesh, there's an increase in rice prices. So there's differences between countries. So one would have to go into each and every country and look at this price data. But now, as I have discussed it with my colleagues upstairs, and some of them say that it's both demand and supply of food shift to the left, decline, then prices may not change, because the one effect leads to prices going up, the other to prices going down, so we don't really know what happened. So we also have to look at production data, not only prices, to be really sure of what is going on. So what has happened with the food production? There's no indication at the world level of a production crisis. So world cereal production has actually slightly increased this year compared to last year. And if you complement that with the news reports from different countries, actually many places now report bumper harvest of staple food. So in a way we have been lucky. So this is a year that there's no big decline in food. So on the slide there are two news reports, one from Economic Times in India a few days, no, from October 16. So they said this is a report from some researchers. So they said that rural households' incomes have stayed resilient in the face of the pandemic and been supported by healthy farm cash flows across regions. So basically it's going okay. Malawi, from August, cereal production in 2020 estimated at bumper levels, helping to bolster household food supplies. So basically production seems not to be a big issue. Here are these aggregate numbers for world production, a slight increase of 2.2%, which is higher than population growth. Yeah, and even when you go into these websites that the UN system is using and so on, that have this early warning system for crops, cereals. This is for Africa, so the green areas that seem to dominate is favorable conditions. And so there seems to be in most places not a problem, but as in northern part, northeastern part of Nigeria, I can see there are problems, and that may explain those increases in food prices that we saw earlier. But this aggregate data is not enough. So ideally we want household level data. And I myself work a lot on household surveys, and that is in general my stand. So we cannot only look, we should look at aggregate data, but we have to go down and see how does anything basically affect the households. The problem now during the pandemic is that you cannot send enumerators out and talk to the households because of the risk of getting the virus. So what people do is to use the telephone. And obviously that leads to many methodological issues. So you don't get the same report with the people on the telephone. So I think it's easier to lie basically on the telephone. So then if some important, you feel there are very important people that call you during this pandemic and ask, do you have enough food? So I think there's a risk that people report more problems than they actually have. So what can we do about this? I think you can minimize this bias by calling the same people that you regularly call. So if you already have a survey that is going on, and not many years ago, but that is regularly going on, if you call the same people, and then you have, first of all, a lot of information about those people, and they know that you have a lot of information, and they know the same person just called you last week and the week before, and so on, going back even months. And if you have very detailed information, so what they do in the most detailed surveys, they ask about every expense they have in the household the last week. And the same person called every week, and now again during the pandemic, they call every week. So that type of surveys, I believe you can trust. I have found one such survey, one published paper on that. There is one more from Nigeria, but with less information on the impact. So, but this other very good study from Kenya, I will now turn to. And remember now that this is just one country, huh? So, but we have to do this study, so ideally there should be many studies and this information should accumulate. But this far I have actually found one, and I really look for them. So this is the survey that is done by, I'm not sure who of these people are leading it, but Wendy Johnson is involved and Menne Pradhan. They are based in the Netherlands, and the other names, I don't know them, but they must be local partners in Kenya. So this is called the short-term economic effects of COVID and risk coping strategies of low-income households in Kenya. So they have been doing interviews every week since, I don't recall, but 6 weeks before the pandemic started, every week before the pandemic started. So it's just a coincidence that they had the survey. They of course couldn't expect the pandemic, but they had the survey. Then they continued 5 weeks into the pandemic. So this is good data, very good detailed data on different expenses and incomes. So they find that income from work decreased, as we should expect. It decreased by 1/3. So it's a big effect. This is on average. Income from gifts and remittances reduced more than 1/3, even more. But household expenditures on food remained at the same level. So this is in line with what I discussed earlier, what you actually should expect. So people prioritize food. They did not cope by increasing borrowing or selling assets or withdraw savings. But they gave out less gifts to the other people. And so basically there were less of these social transfers between households that you normally find in times of crisis, because everyone is hit at the same time. And they also reduced expenditures on schooling and transportation. So the main conclusion is that despite that income decline, they were able to maintain food consumption. And this came at the cost of risk sharing among households. So basically those who were hit harder were not helped by the neighbors, because the neighbors were also afraid that they would lose income. So if I should just summarize everything now, so on the impacts, so the strict lockdowns that you had to do in some countries because they didn't restrict travel, have led to loss of income for many. So at the aggregate level, there are some estimates that say that there's a 5% reduction in GDP in the world, basically. So the World Bank has done these estimates. What does that mean? So if a country grows by 2.5% per year, that means to go 2 years back in time, okay? So basically people go back to the incomes they had in 2018. So in a way, it doesn't sound that bad, maybe. It depends on your income, huh? And Sumner and now a new World Bank report, they estimate that this 5% drop maybe increased poverty by 10%. So world poverty rate now is at about 10%. So if you increase 10% by 10%, you go up to 11%. So they expect an increase from 10% of world population being poor to 11% of world population being poor. But remember now that these are just estimates. So they're not really gone into looking into people who have are sick because of the pandemic or actually lost their job due to the restrictions. These are estimates based on what we know about the correlation between the decline in GDP and increase in poverty. Yeah. So what we found from just thinking about it and from that single study I mentioned is that, and also price and production numbers, is that it seems like people have been able to maintain consumption of food. And by that, since income have declined, we know that other stuff must, consumption of other stuff must, and services also must have declined. This is this Sumner paper. So it's basically what I said already, that if you look at the upper line with a 5% decline in GDP, that will lead to 1% increase in poverty, percentage point increase in poverty at the $1.9 per day estimate. So all these numbers I have shown, they will actually come up. There's a YouTube link that you can look at afterwards and check all the details on the numbers if you want. This presentation will be there. So you can freeze it when you come to the table you want to see. So what can I say about policy? There are 2 more slides, so I think I'm doing fine. I think we have to remember that this is first of all a health crisis. So many people talk about the increase in poverty, the economic cost, but that is a consequence of the health crisis. If we don't do anything about that, the lockdown will be much stricter in the future. So this is a health crisis, and people die. So it's also in itself is a big problem. So what should we do? And some of this you have heard now for months, but we can repeat it. So we need facilities for testing, and there's less of that in poor countries. We need some systems to help people in quarantine. And in poor countries, some places they have a quarantine station. So, for example, for migrant labor, they move into lodges and stay there for 2 weeks. But most poor people, they just stay at home if they're sick. And so you need a system for helping people where they stay. So there could be food delivery just down the street if you live in a slum. So you find some places where people can walk, not a long distance to pick up food maybe. So this has to be developed and is being developed everywhere. So even in the Mumbai slums, they are quite good on this. So many countries this is working. You need sanitation systems all the way down to soap and water. So soap and water is the best way to hinder this disease. And so it's even better than what we use here. So just use normal soap and water. We need a system for distribution of the vaccines when they are approved. Maybe you should prioritize. So there's a lot of talk about prioritizing health workers and people at risk, but maybe super spreader we should also think of. And so people who work as waiters in pubs, restaurants, traders, bus drivers that can bring the virus to new villages and so on. Maybe they should get the vaccine among the first. We should control the spread of the virus via travel restrictions, as I said. And we should avoid those super spreader events, also restrictions on social gatherings, whether that is pubs or funerals or weddings and so on. Then when it comes to poverty, so the consequences of those restrictions. So direct cash, when you lose incomes, direct cash transfer is the direct measure. And that is the best. So just give people money if you lose income. And now with mobile banking that you find many places, that is the most efficient way to do that. So just transfer money to the mobile account or the bank account via the mobile, depending. Even the mobile account is a help. Other places where you don't have that is you just use direct transfers, cash transfers. And I believe that foreign aid can be reallocated to this to a much higher extent. And I know this is now discussed in Norway. And I believe this also is a good policy in the long run. So there's no risk of building up the system because it can also be good in the future. But you should try to base this on existing cash transfer systems in poor countries. There are lots of them, and you should adjust that to the local conditions in those places. Workfare program where people work to get money. They work on some public project. Normally, I would recommend that, but obviously during a pandemic, this is not necessarily a good idea. So I think in this case, cash transfer is to be preferred, as I also summarize here. But if you go beyond that, I also believe that in some cases, for some people in some places, food programs can be good. And we now have Nobel Prize, Peace Prize Committee realizing this. So the World Food Program, they help in those places for those people. So that we should still support that. And this is particularly when we see that the local food market doesn't work well. That's when you need it. So when food doesn't go to the remote places, and maybe because people don't have income, or maybe there's just some physical reason why you cannot transport the food, which is the case now during the corona. And for groups where you just see that lack of food is the obvious problem. And so we can give them cash, but we know they have to spend it on food. So then you just give food directly. So how do you design these food and agricultural programs? There's a list of things you have to do. And I will just go through them. I think I have time. And so I've done some research on this. I actually have a report on agricultural support that you can also look up. But I'm summarizing here what this means, and to some extent adjusted to this particular situation during the corona. So you have to support agricultural extension services. And there may be some produce that is better to during this pandemic, that you don't have to harvest immediately and store them, for example, cassava. That you can store it on the field, basically, and take it when you need it. So maybe some help on that from extension workers. You need access to agriculture inputs, fertilizer, seeds, tractor services. Maybe tractor services are more important now when you cannot use people to the same extent due to the risk of transmission. You don't need to buy a tractor, you just hire it for a day. Safe housing and transport facilities for migrant agricultural labor, a big issue in India. Infrastructure for storage, transport and trade in food. When you buy food, for example, the World Food Program, you have to make sure that you support local food production so you don't destroy the local market. Remember that food can be distributed by way of coupons instead of just food. So you get a coupon, you go to your local shop and market, you send a young boy that don't get that sick if you get infected. Staple food can be distributed directly, since you know that most people eat rice in India anyhow, so you can, and wheat flour, so you can just distribute directly as they do. And for some groups, maybe meals are also necessary. So we have seen this in India for migrant workers that they get meals just because they need it there and that day. So thank you. Yeah. Should I lead? So we take questions from here, and you can use the Q&A on the Zoom. And I think Anja will summarize questions from Zoom. But we can also take questions in the audience. Ja. Vad är det bilden? Ja. Was this very clear, everything?
Hi. I don't know if it works. You said there was an increase in prices in Malawi in December, and it was due to some grasshoppers. I didn't really get what it was.
So we call it grasshopper in Norwegian, so grasshopper. So they basically eat the harvest. So big,
Okay.
Yeah, many millions of them. And I saw now there was a news on NRK. I didn't check the details, but I saw there was the same news now from Ethiopia. But actually, I don't know whether that was old news or recent news. But this is the big food crisis that we have now, the grasshopper locust. So as I understand, there's lots of research lacking on this. You can count even thousands of the papers on corona, but it's not based on much information in my mind. So there's a lot of speculation on what is going on. Ideally, we at CMI should work with the local researchers that go to the villages, but we are also a bit reluctant to do that, of course, because it's a risk to them as well. So my strategy this far has been to just read newspapers, try to check public statistics on prices and production, and hopefully we can go back when we get the vaccine. So immediately when I get the vaccine, I will go to Nepal and start asking people about these things. Yeah.
Where do the governments in that poor countries get the money from to distribute? I mean, it's better to imagine in European countries, but even there in some countries there are like difficulties in that. So where does that money come from that they can give out? Isn't there like a risk of inflation after if they give out money? That
risk of
inflation?
Inflation, you mean?
Yeah. If they don't have the money they actually give out?
Okay. Yeah. So in fact, the cash transfer programs are, from what I know this far, are not big. So I don't think that will be a big effect on macroeconomy in many countries. They should be bigger. I think it's important for donors to help the poorest countries with this. So, and I know Norway is trying to scale up this now. In the slightly richer countries such as India, they are able to afford this themselves, and they try to do it. So the problem with some of the transfers, in my mind, for example, in India, is that they are still relatively small, but they can afford it if they want. So I think people are a bit reluctant because to increase it to big amounts. Also in Latin America, they can afford it. So the main problem in my mind is Africa, in some countries in Africa where there is need for foreign aid. Okay, then we are done. Okay, so thank you for coming, and we can even discuss afterwards if you have questions.